Welcome to the Keys to Success video series. Treatment Acceptance Made Easy with your host Joanne Tanner. This educational DVD was produced as a courtesy by Chase Health Advance. Joanne Tanner has more than 25 years of dental practice management, consulting, and seminar experience. She is one of the nation's top dental consultants and can make a difference in your practice today and produce results for years to come. She has been recognized for her innovation, resourcefulness, and creativity in dental practice management and dental marketing. In today's presentation, you will learn how to develop a quality new patient examination, ways to increase treatment acceptance, and how to provide the best exam a patient ever had. Dentistry is a very complex business. It is no longer sufficient to be an excellent practitioner. Sound business and management skills are also required to maximize the potential of a practice. When a patient is in need of treatment, it's important that they are given the opportunity to see and hear about the best dentistry available. Today, Joanne will help you unlock your potential.
Since the patient's perception is their reality, it is essential that every step of the patient visit, from answering the phone to presenting treatment, is representative of your high-quality care. Case acceptance will not be effective unless you invest time in getting to know your patient and customizing your approach to meet the needs of each patient. In order to encourage the patient to move ahead with the recommended treatment, you must present a meaningful benefit to the patient. Remember, the patient must agree that in his or her own mind, the benefits of receiving the treatment are important. Unfortunately, not all patients buy into the clinical reasons why they should have dentistry. A few do, but many don't. Therefore, the new patient interview is the essential key needed to determine what is meaningful for the patient. This important information will allow you to design your treatment presentation to meet the specific needs of each patient. A very important communication skill to use throughout your discussion with the patient is active listening. Active listening is to be used at any time you hear an emotional statement from the patient. When this happens, instead of trying to justify your treatment, I would recommend that you restate your interpretation of the emotional statement and clarify it with the patient. Remember, you are asking questions, you are not telling. The new patient interview must be designed to encourage the patient to talk while you guide them in a very specific direction. Your goal is to create an atmosphere of thoroughness and caring. When seating the patient, the assistant should step into the reception area, make eye contact with the new patient, and offer an introduction. You may be asking, well, how does the assistant know who they are? The front office person does, and they can simply write on the back of the route slip a brief description of what the patient is wearing. Blonde with a pink shirt, or tall man with the red tie.
Hello, Mary. My name is Alice. I'm one of Dr. Herman's assistants. Nice to meet you. Come on back. You're going to love Dr. Herman. He's so gentle. We have state-of-the-art technology, and you'll be amazed that dentistry could be this comfortable. We have digital x-rays and panoramic x-rays, which are not only more comfortable, but minimize radiation. Please enjoy our satellite TV until Dr. Herman comes in.
Invite the patient to be part of the exam by asking questions and making comments. Tell them what part of the exam you're performing each and every step of the way. Practice verbal skills and avoid words such as maybe, try, probably, perhaps, or should. Use comments like, my experience, or I strongly recommend. The doctor should briefly review the new patient information before meeting the patient so that you're prepared accordingly. The doctor should go into the room as soon as the patient is seated. The doctor will start the exam without x-rays. The ideal situation is that the doctor is only scheduled with the new patient No other operative visit scheduled during this time. The assistant should introduce the patient to the doctor.
Mary, this is Dr. Herman.
Good morning, Mary. I'm Tim Herman. Welcome to our office. It's nice to meet you. I see that you're referred by Sheila Harley. She is one of our favorite patients. I'll be sure to thank her for referring you. Alice, will you put a note on my desk to send Sheila a thank you? Mary, you're probably here for a reason. Why don't you tell me what that is and we'll start there.
I'm here for a cleaning and a checkup.
Great. We're definitely going to do that for you today. I'm going to do a real thorough exam and be real honest with you. I'm going to tell you everything that I see. If I find any problems, I'm going to let you know what they are, and I'll help you make an informed decision about what you want to do about them. Let me ask you, what type of dental treatment have you had done in the past?
I don't know. I've had some fillings and a bridge.
A bridge? Why did you need a bridge?
I lost a tooth.
Do you remember why you lost the tooth?
The tooth broke.
How did you break it?
It had a big cavity and filling in it, and it broke.
How long have you had the bridge, and how's that working for you?
Oh, about 10 years, and everything's fine. I sometimes get food stuck underneath it.
Well, there's something we can do for that. We can do an implant. Have you ever cracked a tooth?
Yes, and then it broke.
Does loss of teeth run in your family?
No, not really.
Have you ever had a toothache?
No,
Do you have any sensitive teeth?
sometimes.
Any concerns about the appearance of your teeth?
They're a little crooked.
Well, usually for a problem like that, we recommend orthodontic treatment.
Do you recommend that for me?
Well, that depends. We're going to have to get some more information and take some x-rays.
Okay.
Utilize your active listening and communication skills to use their words and their experiences to present the problems that you find and the solutions for them. You can't offer any solution for them until they understand that they have a problem. Discover the problem first, then offer solutions. The patient has to realize first that he has a problem. Then, if they do ask you, is that what you recommend for me? Your response should not be, we would do a crown. Instead, respond with, that depends. We need to get some additional information and take some x-rays. You see, with this approach, the patient never complains about us taking x-rays.
With your permission, we'll place a patient bib and lean you back and start your exam. The first thing that I'm going to do is an oral cancer exam and a TMJ evaluation. Next, we'll take a real good look at all your teeth, and if it's okay with you, I'll simply describe what I see.
The patient will give you approval, and we start with the exam. When you are doing an exam, get away from dental ease. Instead, use plain English. Frequently, the exam would start on the upper right posterior quadrant, and the dentist will say, all 4/3 are missing, tooth number 2, MOD amalgam, tooth number 3, MOD amalgam, tooth number 4, and on and on. My recommendation is to chart all existing restorations. While the assistant is charting, the doctor is talking. Now, this is an example of the exact same sequence using plain English.
Tooth number 1, 12, 16, 17, and 32 are missing. Tooth number 2 has a large old dark silver filling that goes on 2 sides of the tooth. It's taking up about 80% of the tooth structure. The margins are starting to break down between the tooth and the filling, and there's some gray staining. Tooth number 3 has the same kind of filling that looks about the same size. The cusp of the tooth on the tongue side appears to have been fractured off, and I can feel decay with my instrument. Tooth number 4 has a tooth-colored porcelain fused to metal crown. Margins look good, and it's in good shape. Number 5, no fillings, looks good. Number 6 looks good. Number 19 has a tooth-colored crown, and it looks like it may have had a root canal because there's a filling through the chewing surface of the crown.
This type of verbal exam is clearly telling the assistant what to document, but more importantly, the patient is understanding the need for treatment. For example, when the doctor says front, that means mesial. Back means distal. Lip is facial. Tongue, lingual, and chewing, occlusal.
I see that you've had a lot of dental treatment. Most of it looks like it's doing pretty well, but there are some things that are breaking down. We need to go ahead and get some more information to see what we need to do about those. The next thing I'm going to do is a test on your gums. Good numbers are 2s and 3s. Bad numbers are 4s, 5s, and 6s.
So don't go into a lot of biology right now, as we simply want the patient to listen. And if the patient has healthy gums, why are we going to have a conversation about periodontal disease?
3, 2, 3, 3, 2, 4, 3, 4, 6.
Complete the periodontal charting, including recession and furcation.
Have you ever had that done before?
No.
Many people respond with no, or maybe yes, but never that thorough. The patient may have had it done, but no one explained it to them, or no information was given. Now, go over some diagrams that help show healthy gums to gingivitis, periodontitis, furcation involvement, and then loss of teeth. The progression of the problem, so they receive the ideology of gum disease and yet a mini lesson of what's going on. Review the progression of gum disease, and the patient will frequently ask, "Where am I?" The doctor will now leave and do a hygiene exam while the assistant takes the x-rays and uses the intraoral camera. If the doctor completes the hygiene exams before the x-rays are done, he will then go to his computer and start charting existing restorations and entering the treatment plan. Now, we realize the dental assistant cannot diagnose. However, she can plant the seed to the patient to understand the need for potential treatment. There is a definite benefit of having a non-dentist have the discussion prior to the doctor diagnosing treatment. It is also important for us to note that if the clinical team is pre-presenting the treatment and the doctor is not addressing the same needs, fairly soon that assistant or hygienist will stop presenting treatment as it makes them feel and look inefficient. Now, in addition to taking the necessary films, the assistant's goal is to educate the patient on the value of restorative, periodontal, and aesthetic dentistry, and to set the stage for treatment by discussing obvious needs with the patient, such as large restorations that are breaking down, possibly a crown, discolored and leaking composites, replacing the filling, cosmetic improvements including whitening or orthodontics, missing and drifting teeth, an implant, or a bridge. So point out obvious problems by using the intraoral camera.
That is a pretty large filling there. I know the last time I saw a tooth that looked like that, doctor had recommended a crown. You know, if that was my tooth, I would want to talk with him about possibly placing a crown to protect it.
Do not discuss your suggestions with the doctor in front of the patient. Instead, document them on the route slip or some other form of nonverbal method of communication. If two people come up with the same treatment recommendations, the patient is more likely to accept it. When I work with my consulting clients, we frequently say that we believe in diagnosing WIDIOM, W-I-D-I-O-M, and that stands for would I do it on me or would I do it on my mom? After x-rays are complete, the doctor comes back in to do the initial scaling and turn the patient back over to the assistant for polishing and fluoride treatment. The doctor will then go to his computer, review the x-rays, and complete the treatment plan. The patient is placed in the consultation room. Review the problems that were found.
Do you remember the tooth with the cracked filling? That's a problem. The gum disease is also a problem, as well as your concern about crooked teeth.
Once they understand they have a problem, the patient realizes it's their problem and they will fix their problem. If the patient doesn't know that they have a problem and they do the treatment that we presented, then when that tooth hurts, it's our fault. If the patient has a problem, even though they don't have any pain, and we do treatment, and then they experience any complications with pain or discomfort, Then you can go back and say, remember the problem with that tooth that had the failing old silver filling and you had multiple cracks in the tooth? Unfortunately, in our attempt to fix the problem with your tooth, the nerve has been irritated, and these are our options. The verbal skill outline to increase treatment acceptance is this. The doctor will say, you have this problem, whatever it is, and like you've had with some of your other teeth that have this same problem. Normally, what we recommend in this situation is this. You see, patients will fix their problems. They will not fix our problems.
What we generally recommend for our patients that have these types of dental problems is starting with 4 quadrants of non-surgical periodontal therapy, a root canal, crown, and buildup on that tooth with the cracked filling, as well as an orthodontic evaluation to address your concerns about crowding.
We suggest you say, Mary, you have a large filling that's breaking down and starting to crack, rather than saying, Mary, you need a crown on number 2. You see, this approach is problem development, where we make sure that the patient realizes that they have a problem. If they don't understand that they have a problem, there's going to be some buyer's remorse, hence no shows for the appointments. We want you to present the treatment in third person. For example, do not say, Mary, you have this cracked tooth, and what we need to do for you is a crown. Instead, say, Mary, you have a couple of teeth in your mouth with large old silver fillings in them, and they're very likely to break. What we normally recommend for patients that have a problem like this is a restoration that will protect the tooth and hold it together. That would be a porcelain crown or gold crown. The patient is now listening. I think that you'll agree that the patient will stop listening when the doctor says, Mary, you need this. Of course, the ideal situation would be when the patient responds with,
Is that what you would recommend for me?
Yes, if you want to save the tooth, that's what we would recommend.
Now notice, when you're using third person, we are not saying you need, and do not end with, do you have any questions? Instead, say, does that make sense to you? You see, with this problem development approach, you will have very few objections. For example, if you go in to have your oil changed on your car, and you don't notice any problems, you're just in need of service, and someone says to you that you need a brake job, you're going to be hesitant and concerned. You might say, do I really need that? I just wanted to get my car serviced and my tires rotated. But if you can show them how much tread they have left on their tires or pad left on their brakes, they are more likely to believe you. So, if we can show the patient that they have a problem with the tooth by showing them with the camera the cracks on the tooth, or the defective alloy, or maybe an open margin on a crown, or the fact that we are able to place an Explorer under a crown with an open margin and it sticks, and the patient can feel it, they know that they have a problem. Simply telling the patient is not an effective way to convince a patient to accept treatment. You have to ask questions. Without questions, you are unable to uncover what the patient's perceptions and expectations are, and have the ability to meet those expectations. Asking questions will allow you to tailor your presentation to meet their expectations. So how do you know if the patient has really accepted treatment? Do you have any questions you may ask your patient? The problem is, this does not mean the patient's ready to move ahead with treatment. Many of my clients are uncomfortable with asking, are you ready to start treatment? Frequently, the patient will ask, how much is this going to cost? Now, doctor, don't shrug your shoulders and say you don't know because the front desk told you that's not your job. Instead, respond with, Mary, it sounds like fitting this treatment into your budget is important to you. Is that right? Or, doctor, you may quote the fee if you're comfortable. Then, continue with, if Susan at the front desk can find a payment plan that is comfortable for you? Is there anything else that would prevent you from scheduling the treatment at this time? If the patient says no, that means they're ready to start treatment. Now remember, an objection is not a no. It is an invitation to ask more questions. If the question is in the form of active listening, you will diffuse the emotion and allow the process to continue. The patient who is asking questions and has objections is really trying to gain more information from you in order to be comfortable with what you're telling them. The patient who sits very quietly, shakes their head yes, and has very little to say is the one who is not accepting treatment. They're probably thinking, as soon as I get out of this chair, I'm going to tell them I need to think about this. For a patient who has not established a trust level just yet, or is really worried that they will be pressured into treatment that they don't want, this approach will be very attractive. Once the patient has heard everything they need to hear, has asked you all of their questions, and once you have discussed all their objections, we are now to the decision. It is important that at this point you determine whether or not the patient has accepted your recommendations. And this can only be accomplished by asking, Mary, is there anything else that I need to know that would prevent you from moving ahead with treatment at this time? Most patients will respond with, well, only if I can afford it. And then you can respond with, Mary, we have a number of different payment options to assist you. So if I heard you correctly, if we can find something that will fit into your budget, then you're ready to move ahead with treatment? Now you'll have a yes from the patient. Please keep in mind that the financial coordinator cannot close this for you. The patient should come to the financial coordinator with an attitude of, I need this, help me afford it. But if their attitude is, well, tell me what it's going to cost, and then I'll tell you if I'm going to do it, the treatment has not been accepted in the operatory. Unless you ask numerous questions throughout your case presentation, you will not know whether or not the patient has truly accepted the treatment. Unfortunately, I think questions are often too vague to pull the information you need to know. So avoid questions such as, do you have any questions? Patients usually answer with no because they don't know what to ask. Your questions have to be very precise. For example, Mary, do you understand why you'll lose this tooth if we do not replace this deteriorating restoration with a crown? Or you might say, Mary, do you understand how destructive this infection will be if we do not perform a root canal on this tooth? Once you've obtained a commitment from the patient to move ahead with the recommended treatment, it is important to hand the patient over properly to the financial coordinator. This handoff will set the stage to move ahead with the payment arrangements and solidifies that the patient has agreed to proceed. For example, Susan, Mary has decided to go ahead with the treatment plan. However, it's important that you help her to establish a payment arrangement that will fit within her budget. Or you might say, Susan, Mary mentioned that if you can help her find a comfortable payment plan, then she would like to begin treatment. And Susan, if you have any time next week at all, I would like to start on the upper right side. In other words, doctor, you need to create a sense of urgency. Remember that your case presentation skills need to be reviewed and comfortably used by you so that your patients can receive the very best dentistry that you can provide. And finally, remember that ultimately the case presentation will require the skills of your entire staff. This team effort will enrich your practice. In order to support all of your efforts to bring the patient to this point in the process, it is essential that your financial system is structured to offer affordable payment options to the patient without putting the practice at risk or establishing you as a banker. The cost of operating the practice, the overhead, is directly proportional to your production. It is essential that we collect everything that we produce. So there are some important considerations. Number one, maintain a production to collection ratio of 98% on a 3-month average. 2, maintain the accounts receivables at no more than 1.2 times the 3-month average production. And third, maintain the accounts receivables over 90 days at no more than 15 to 20% of the AR. 4, we need to encourage patients to say yes to the best dentistry without putting your practice at risk. 5, we need to reduce any financial surprises. Inform before you perform. 6, we do not want patients to be offended nor make them feel mistrusted. 7, minimize the collections calls. And lastly, enhance your marketing efforts. The treatment fee and payment options discussion is one of the most important conversations you will have with the patient. Because of the economy, more and more patients may choose to delay or decline their dental care or even hygiene. That's why it's important to present the fee and payment options in a way that encourages the patient to move forward with their dental care. If the patient delays treatment, it will only end up costing them more in the long run. It is important to partner with the right third-party patient finance company. We recommend Chase Health Advance, which is part of Chase Bank USA. You can enroll for free by calling toll-free at 888-388-7633 or visit them online at chasehealthadvance.com. We recommend them for 2 reasons. First of all, since the product is offered by Chase, most patients are familiar with and trust this brand name, making it easier to offer to your patients. Secondly, Chase also offers all approved patients a $5,000 minimum credit line, meaning more patients can accept the most comprehensive treatment that you recommend. And third, they offer free case presentation tools that make discussing payment options easy. Now, you must have a completed treatment plan. Ideally, this treatment plan is given to the financial coordinator at least 5 to 10 minutes prior to meeting with the patient. Patients appreciate knowing that they have many options. In order to be perceived as affordable and flexible by your patient, you need to offer payment options. These options must be beneficial to the practice as well as to the patient. The patient will then select the option that best meets their needs. It's important to have something visual to show the patient, and not just the treatment. It needs to have the payment options. Without the payment options, the patient is only going to remember the big number and not what the monthly payment plan with all the attractive options. The form we don't suggest is the one that is generated by the computer because it breaks the treatment down tooth by tooth and it encourages payment per appointment. Please see the sample payment options form.
How much is this going to cost?
The investment in your smile is $37.50. We have estimated that your insurance will cover $500, leaving you a balance of $32.50. Dr. Herman understands the importance of your oral health and helping you achieve the smile that you have always wanted. So we are happy to let you know that we offer 3 payment options, including a very attractive no-interest payment plan that requires no money out of your pocket today. Let me go over them with you, and you can select the one that best works for you. Because check and cash is the preferred method of payment at our practice, we offer you a courtesy of 5% for payment in full today, which is a savings of $162.50, which leaves you an investment of only $30.87.50 today. Our second option is normally a 6-month no-interest plan, but I am happy to tell you that we now have a 24-month no-interest payment plan. This would be 24 equal payments of $139 and no money out of your pocket today. And lastly, if you want the smallest monthly payment, you can apply for Chase Health Advance Financing. Extended payment plans may be available to you, which would allow you to make smaller monthly payments. The payments would be between $113 and $137 per month with interest. And again, no money out of your pocket. Which of these three options best fits your budget?
Highlight the boxes on the worksheet so the eye moves down to the payment plans and not to the big number. So the patient says, I need to go home and talk about this with my husband, you can send them home with a tool that clearly communicates all of the different options that are accepted in your practice. And for those patients that tell you, I want to go home and talk about it with my spouse, you now have an excellent form for them to take home. Hand them the payment options worksheet and the Chase Health Advance patient brochure, which outlines the benefits of using a flexible payment plan. Plus, the printed worksheet provides them with all the appropriate information and disclosures for third-party patient financing that are now required under the new federal regulations. Then, be sure to gain commitment to follow up the next day by asking, Susan, I will call you at 3 p.m. on your cell to follow up with you. I have an opening next Wednesday, which I will hold for you until then. If the patient were to go home without the payment options worksheet, what will the patient likely share with their spouse about the cost of the treatment? I think they'll say, it's going to cost $3,500. However, when the patient shares the form with his or her spouse, the conversation changes to, it's going to be $3,500, but only $139 a month. I can do this with no money out of pocket. So you see, when you offer 24 months no interest for treatment of $3,000 or greater, your case acceptance is going to escalate. To gain access to this useful payment options worksheet as a visual presentation tool, you should contact Chase Health Advance at toll-free 888-388-7633 or visit them online at chasehealthadvance.com. If you have any questions or if you'd like additional information, please call us at 916-791-2720 or visit our website at joannetanner.com.